Hi, my name is Samantha Lomacleese, and I recently joined the RRP Foundation as a volunteer. I was diagnosed with juvenile onset RRP when I was around 3 years old. There's me as a little 3-year-old. And since then, I've had around 54 surgeries, which include laser removal of nodules on my vocal cords. When I was a toddler, my voice was very weak. I had trouble sleeping through the night and was less active than other kiddos due to labored breathing. This led my mother to take me to the doctor multiple times throughout my toddler years. I remember her telling me we visited 3 different doctors who all treated me for upper respiratory infections with antibiotics before meeting an ENT who agreed to do a scope. So, right before my third birthday, right after the scope, the ENT told my mother I was breathing through an airway the size of a pinhole, which then led to my first surgery and the diagnosis of RRP. After my diagnosis, I had a surgery about every 3 months. As I got older, they slowed down, and there was hope of remission after puberty, but unfortunately, that didn't happen, and I've continued to have them into my adult life. And consistent with the risk factors associated with RRP, my mother was a young mother, and the financial stress of all of the care was not an easy lift for our new family. It was mostly her and I waking up for all of the early morning surgeries and appointments. I mean, just the ability to take off work, the amount of time and resources it takes to care for someone with RRP is a significant weight for a new family to bear. So I continued to live a fairly normal life even after the diagnosis, except for, doctor's appointments and surgeries. As a kiddo, I still participated in gymnastics and cheerleading from elementary school to high school, which my mother thinks were key to my developmental health after the RRP diagnosis. And, at times it was hard. I would be on voice rest, or I would only be able to utter or whisper, or just be completely removed from school altogether due to surgeries. And it put a stress on my social life growing up. I was, and I still am, a very outgoing person. I always got the Sam likes to talk on my report card. So while people couldn't physically hear me sometimes, I always made sure to make myself heard. And this became important as I moved into my teenage years because I did suffer from depression and self-harm. And I think the stress and periods of isolation from the illness weighed on me along with the normal stress of being a teenager. But I went to therapy and continued on, and then I independently moved off to college right out of high school. And from then on, the surgeries were my responsibility. And that was a big change for me. But I learned how to manage my illness on my own, found new doctors, and started to learn how to be an advocate for others with RRP. I now currently live in Moorhead, Kentucky with my husband, 2 dogs, and 2 cats, and about 40 houseplants. I have 4 younger sisters who I love very much, and they help make up my support system, which every patient needs with this diagnosis. While I had surgeries frequently, I got my master's in experimental psychology from Moorhead State University, and I'm currently the senior manager of operations and measurement at Care and Guidance. We are a national education consulting company, and I'm currently also continuing my education through a certificate in systems thinking from Cornell University. So I like to keep myself busy. I was fortunate enough to be in remission from surgeries from 2016 to 2021, but then my voice started to decline, and I knew it was time to return. That's kind of the thing about RRP. It's reoccurring, and it may be a few months or a few years before you have to return to your ENT for that surgery appointment. But you know in the back of your mind that more than likely you will always have to return because there are not many treatments for RRP. It's kind of a funny story how I came across the RP Foundation. I was browsing Instagram and I was on a work trip in New Orleans, and I remember I was out to dinner and I told my friend, I was like, I'm gonna put my anxiousness aside and I'm gonna reach out. And then I chatted with Kim via email, and here I am. And now, after learning more about the foundation, I am really excited. Their goals are amazing, and it is imperative that those diagnosed with RRP have more treatment options than a lifetime of surgeries. So I encourage everyone who is a patient, a family member, an ally, to find ways to become an advocate or get involved either via promotion of the HPV vaccine or research for treatment options, or maybe just by joining the RRP Foundation yourself.